Hey everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Chlorthalidone. Its brand name is Thalitone. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. And quickly, if at any time during this video you find this information to be valuable, please consider leaving a like on the video as it would really help me with the YouTube algorithm. So first, what will we cover in this presentation? We'll start by talking about how chlorthalidone works. We'll then discuss indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe chlorthalidone. We'll then discuss examples of dosing, and then stick around to the end where we'll talk about side effects. So how does chlorthalidone work? Well, chlorthalidone is an antihypertensive and diuretic agent. It increases excretion of sodium and chloride. In terms of indications or reasons we would prescribe this medication to a patient, we often see it used in the treatment of hypertension or high blood pressure. It can also be used in the case of edema. With respect to contraindications or reasons we would not be able to prescribe chlorthalidone, we wouldn't give it to a patient who had a hypersensitivity to chlorthalidone, other sulfonamides, or any other component of the formulation. As well, we would not give this medication to patients who have anuria, which would be an inability of the kidneys to produce urine. Note about dosing with chlorthalidone. So in the treatment of hypertension or high blood pressure, the initial dose would typically be 12.5 to 25 milligrams orally once daily, with the option to increase the dose to 50 milligrams once daily if needed, and the maximum dose would be 100 milligrams per day. In the treatment of edema, the initial dose would be a little bit higher here, 50 to 100 milligrams orally once daily, and they may use 100 milligrams on alternate days as an alternate therapy. And the maximum dose in this situation would be 200 milligrams per day. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using chlorthalidone, so we'll go over some of those here now. Some patients may experience dizziness or a headache, as well as restlessness, vertigo and orthostatic hypotension, which would be a sudden drop in blood pressure when going from a seated to a standing position, are possibilities. Some patients may experience vasculitis or skin photosensitivity. Some patients may experience a skin rash or toxic epidermal necrolysis, also known as TEN. Electrolyte imbalances are possibilities, as well as a granulocytosis or leukopenia. That's all we're going to talk about today with chlorthalidone or Thalitone. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.